Welcome to this discussion on the DurAVR transcatheter valve. We are going to discuss the DurAVR 30-day outcomes in the first 100 patients. I am Nicolas Van Mieghem and I'm joined by Ole de Bakker. Ole, can you discuss the 30-day outcomes in these first 100 patients?
Yeah, so that was actually interesting. We collected, with the help of Antares, of course, the first 100 patients with small annuli treated with the small-sized DurAVR valve, and wanted to see how was the performance of this valve for the early outcomes, 30-day outcomes. So first, I would say we look to the safety pattern, safety profile of this. Well, that turned out to be excellent. There was, if we look also to clinical outcomes at 30 days, procedural efficiency was and safety technical efficiency and success was very high. It was close to 95, and in the last cohort, even 100%, yes, of technical success. There was on the 100 patients at 30 days, there was 0% mortality. There was 2% of stroke, totally in line with what, and this was an intermediate, relatively high intermediate risk population. And there was only 6% of pacemaker. And for the rest, almost no other major complications. Then if we look to the valve performance, that was even better than that. I mean, it was really outstanding. Single digit, remember, small annuli patients, single digit mean gradient around 8 millimeters mercury, EOAs of above 2.2. There was no moderate PVL. There was 70% of none to trace, 30% of only mild PVL, and we were not very selective in the inclusion. There were excessively calcified cases. There were even 9% bicuspids in this. So just to tell you, there's not highly selected population group. And then coming back on the hemodynamics, looking really in the ppm then, the moderate ppm rate was 2%, severe ppm 1%. So 3% of moderate to severe ppm in a population group at high risk of ppm, prosthesis patient mismatch. So this was, I mean, truly outstanding results.
Was there also some data out to 1 year?
Not yet. I mean, I think there is some on a smaller cohort. I did not present this, but there's a smaller cohort in 37 patients. But actually, the valve hemodynamic superiority remains. So there is it's still a very early signal, but up to 1 year, it confirms the excellent hemodynamic profile of this valve. So maybe a question to you then. I mean, you also know very good all the literature in the tower. So how does this compare with current literature and data on small annuli patients?
Well, I must confess, I'm quite impressed by the results, because we're talking about a balloon expandable valve, but at the same time, it introduces a novel concept. This is this biomimetic valve design, and then the question is, does this translate into better hemodynamic valve performance? And then obviously you will refer to the SMART trial that was comparing two different platforms, so a supraannular functioning self-expanding system versus the balloon expandable sapien valve, and there it was clear that although from a clinical point of view, there was no difference in outcome between the two valve platforms. In terms of valve performance, the supraannular functioning valve was outscoring the balloon expandable system. Based on the data that you presented, that this biomimetic balloon expandable valve really shows a hemodynamic valve performance that is completely in sync or even better than what we saw with this with the Evolute valve in SMART. We have to always be careful with cross-comparing the trials and registry data. But that said, I think all these data that we've today are very promising and are also very encouraging for the randomized paradigm trial that is currently enrolling patients.
Yeah, it confirms to me. I mean, it's really that unique factor of the single piece biomimetic leaflet design. It mimics really, it's the first valve ever that really tries to mimic the same kind of coaptation and opening of an aortic valve as a healthy normal aortic valve, and I think they see that translated in really great valve performances.
That's an excellent conclusion.
Well, I want to even say more about if you look beyond the aortic valve itself, because now we're discussing very much about prosthesis patient mismatch, that very high focus on that. But I think also what this sub-study hopefully can show is that, again, you have to look beyond that aortic valve. I mean, it's not just getting to the best hemodynamics and the lowest gradient possible. It's also restoring that aortic flow to a laminar flow, no turbulence there, and that can all contribute to a better valve durability, but also probably a better LV remodeling and probably better symptom relief for the patient and even better clinical outcomes for your patients on the longer term. But that will have to be shown in the paradigm trials.
But also important to realize that these exciting concepts of laminar flow are also not present with surgical bioprosthesis. So we are definitely entering a new era of aortic valve therapies. Thank you very much, Ole, for your contribution. Thank you very much for staying with us.